Depression is a very common illness. 1 of 5 adults are expected to experience at least one episode of depression in their lives. The symptoms can vary a lot, but often they are low mood, low energy level, and motivation, poor concentration. Sometimes people are unable to enjoy things that they would normally enjoy doing. They can get anxious with very minor triggers. They can worry a lot. Sometimes the sleep is affected and the appetite. And also the degree of these symptoms, how severe they are, can vary a lot. Many people aim for their lives to be happy, and depression is an illness that steals exactly that. The good news is that with right treatment, with assessment and the right treatment, it is a condition from which people can fully recover and go back to their lives. Depression can follow a life event, for instance, breakdown of a relationship, or loss of a job, or loss of a family member. It is a biochemical imbalance in the brain. Genetic factors are important in terms of what kind of symptoms people experience when they're depressed, whether they will become depressed, or how many episodes are likely to have in their lives. That depends on how severe the depression is. Generally, it can have a very negative impact on people's lives. For instance, if the symptoms are very severe, sometimes people are unable to work. It's possible as a result they may lose a job, and then trying to find another one whilst depressed can be very difficult. Sometimes a depressive episode can be linked to a relationship breakdown, because this can be more common when people in the family don't know about depression, they don't recognize it, and they only see someone who suddenly behaves in a different way. They may be irritable and have arguments, or they may be very withdrawn. So, for instance, there may be a divorce. Sometimes when people are very, very depressed, they may start developing ideas that life is not worth living, and sometimes they may even act on these thoughts. So it varies. Sometimes it's just, well, it's a very unpleasant experience, or sometimes the complications can be much more severe, and this is why seeking an assessment with a professional early and appropriate treatment is very important. Early diagnosis and treatment can certainly prevent complications from occurring. So by starting evidence-based treatment soon, it is very likely that the symptoms will get better and the individual would achieve a full recovery. And of course, it is much more likely that's going to happen if their life is still where it was and there aren't complications like job loss, relationship breakdowns, this type of situations. Depression can be diagnosed by a trained professional, like a psychiatrist. The main treatment is medication, psychological treatment, and psychoeducation. In terms of medication, the type would depend on exactly what symptoms are there. Also, what type of side effects would not be acceptable to the individual. Other factors are relevant. For instance, is the individual on medication already? Have they taken medication for depression before? What type of medication? How did it go? Did they work? What type of side effects? Then there is psychological treatment, and again, there is a huge variety of types of psychological interventions. There is cognitive behavioral therapy, there is counseling, there is psychodynamic psychotherapy, there is family therapy, there is integrative therapy. I mean, there are lots. And again, each one would depend on whether there is a trigger and what type of trigger it was, the individual's preferences, whether they had psychological treatment before, what type, how it went. And also it will depend on whether there is any comorbidity, meaning another mental health diagnosis in addition to depression, and often it's relevant experiences in early life, in childhood. There is a point that is interesting about medication, and many psychiatrists don't talk about. So that many people prescribe antidepressants, and many people stop them. And often the thing they don't talk about is the sexual side effects of antidepressants. So there are antidepressants that are very commonly prescribed, like sertraline, citalopram, venlafaxine, that have a very high incidence of sexual side effects. There is a meta-analysis by Sereti and Chiesa that says that specifically these three antidepressants, 80% of patients will have sexual side effects. That's quite a lot. That's, we give it to 5 patients and 4 of them experience these side effects. However, newer antidepressants tend to have no sexual side effects at all, or a smaller percentage of patients develop them. So it can be a quite complicated thought process around which antidepressant is best and would suit the needs of the patient. I guess the good news with this disorder is that with early diagnosis and appropriate treatment, most patients fully recover and can go back to their lives.